Welcome back to Autism Live. I'm Shannon Penrod. I'm here with Dr. Jonathan Tarbox. He's the head of research and development at the Center for Autism and Related Disorders. We're so thrilled to have you with us today.
Thank you.
And you have a study that you guys did about stereotypy. Tell us, fill us in about that.
Sure, okay. So there's sort of a long-standing assumption in the autism community that stereotypy or repetitive behavior is automatically reinforced, meaning that it produces its own reinforcement. That's where the term self-stimming came from, right? Yeah. Self-stimulatory behavior implies that the behavior produces its own reinforcement.
And in the community, people refer to it just as stimming.
Stimming,
they
yeah.
say, oh, my kid was stimming.
A lot of folks don't even know where that came from. Yeah.
And I remember the first time somebody said that to me as a parent, I said, stimming? I don't know what that is. And it was a person, before we started ABA, you know, they have just this sort of generic, that they let your kid go to this group. And I said, the person referred to this, and I said, well, what's stimming? And she didn't know. She said, I don't even know what it means.
Yeah.
And this was the level of what they...
That's really scary.
It is scary.
But yeah, it's like so in common use that people have even, so don't know where it's coming from, that people even say stemming sometimes with an E, like a stem of a plant.
Yes.
It's funny.
And you go, what, is my child sprouting?
Yeah,
what
are you talking about?
Explain this to me, Lucy. I don't understand. Yeah, scary. And then you go to look up stimming in the dictionary or look it up online, and of course, it isn't a word.
There's nothing,
So you can't find anything. And you go, well, my child's doing this. Somebody help me.
Yeah. So, okay, so there's this big assumption that it's always producing its own reinforcement. And so we went and looked at existing research literature, and there were some studies showing that sometimes stereotypy, I'll use the word stereotypy, that's a more scientific word. There were quite a few studies actually showing that stereotypy was maintained by some other source of reinforcement. Like, for example, some kids are doing it for attention, some kids are doing it to escape from academic tasks, but also quite a bit of research showing that it was maintained by automatic reinforcement. Most of the studies were with pretty small groups of children or adults, sometimes 2 or 3 individuals per study. So we basically just wanted to look at it on a larger scale and just say, well, let's just look at our kids that we serve at CARD and let's take a look at it. Let's functionally assess a whole bunch of these repetitive behaviors.
I kind of feel the need to step back for people who are new to talk just for a second about, so give us some examples of this, what stereotypy would be.
Great, thanks. Yeah, that's a good idea. So the list was, I don't know, maybe 20 or 30 or so different behaviors. Common stuff that people think of all the time, like hand flapping and rocking, those were in there. Lots of sort of finger or hand manipulation. Some kids will, manipulate their hands and stare at it. Turning light switches on and off, staring at ceiling fans,
opening and closing doors.
Yeah, exactly. Yeah.
Looking at the wheels on the car. Is lining up the cars included in that? All those different things.
Absolutely.
The humming.
Yeah, making sort of unintelligible sounds, squeaks, noises, whatever. Repeating phrases, echolalia, delayed echolalia, often called like video scripting, so reciting scripts from videos or cartoons, not in the context of actually playing or acting out those things, because then that would be sort of pretend play, but just with no apparent context, so just kind of repeating it to oneself.
They're the kinds of things that can make parents crazy.
Yeah.
And that you go, I just need you to stop that. I don't know why you're doing it. I just need you to stop that. We had Laura Mariquin in a couple of weeks ago, and her son, there was, it was a door thing and elevators, and they would go someplace, and the doors of the elevator,
had to watch it open and shut,
would become a whole big meltdown.
Yeah, if he wasn't able to just watch it. Yeah.
Those kinds of things that really make us all want to tear our hair out. Those kinds of things.
I've been treating severe problem behavior in kids with autism for, 13, 14 years. And the number one thing that parents always want dealt with is stereotypy.
Yeah.
Above and beyond, aggression or SIB or anything else, they want stereotypy dealt with. And it does, I guess, kind of just drive you nuts, because it's so repetitive, it's so over and over, And
there was somebody who wrote in...
it does make the kid really stand out,
it goes to the heart of everything that you go, why can't my life have some semblance of normalcy? Somebody had written in the other day and said, I don't know why, some days I can just tune my kid's stereotypy out, but today it's one of those days that every time he's doing it, it's like a nail in my head. Can somebody please give me a vacation from this? And everybody wrote it and said, oh man, I've had that day. We just go, seriously,
cut it out.
In my worst autism parent moment, I remember I was having a very stressful day, and I said to my son, can you just stop having autism for 1 minute.
Oh my
You know, and then I just wanted to like throw myself off a pier and go,
Yeah.
oh, you know, somebody fire me from parenthood. Like, and I said it to him. Oh, bad moment. But you feel that
Nobody's
way
perfect.
sometimes.
Yeah,
Yes,
yeah.
no, and I tried to forgive myself for it, and he certainly is free. But you know, it's those moments where you go, you know, please, I can't take it another second. It's those kinds of behaviors.
Yeah. So, okay, so what we did was we looked at a bunch of those behaviors, and what we wanted to know was, why are they happening? What's the source of reinforcement? And so we did this across a large group of kids, and we found, by and large, actually, it was mostly maintained by automatic reinforcement. So our study did actually kind of...
Explain, so what automatic reinforcement means.
Sure, yeah. So basically, a lot of times folks will engage in behaviors, inappropriate behaviors or excessive behaviors, in order to get attention from others, in order to get access to something they want. We call that tangible. So it could be getting food or toys, or they don't want to share, they want to watch a favorite show. And a lot of times it's escape from a non-preferred task. So escaping from having to clean your room, escaping from homework, escaping from schoolwork, whatever the case may be. Sometimes just escape from even being talked to. You know, sometimes kids just want to be left alone. So all of those sources of motivation affect problem behavior and are common sources of motivation for problem behavior. Automatic reinforcement is different. It's where you've ruled out all of those, and what you've found is the behavior, it basically produces its own reinforcement. So you do it just because you like doing it. So good examples for you and I are, you know, scratching a mosquito bite. We don't do that because someone else gives us attention or something. It just feels good. Reading a good book, you know, a novel, you just get your own enjoyment out of it. Watching TV, for the most part, you just enjoy doing it, right? Eating food, all of those are just sort of automatically reinforced behaviors.
Well, I just noticed that as we were sitting here, I was playing with my fingernail.
Yeah, I'm constantly fidgeting. Yeah, constantly.
You know? And I'm not doing it because my fingernail itches or anything. I'm just sitting here playing with my fingernail because it just, you know,
it just produces its own satisfaction. Yeah, exactly. Yeah, I find when I'm giving talks at conferences, I'm constantly fidgeting just anytime I'm awake. So I have to do specific things to prevent that behavior, because it's distracting if a presenter's doing that. So I have to like hold the podium with both hands, you know, on purpose. So I have my own little self-interventions.
There you go. It's wonderful. You're walking your talk. We like that. But these things, for whatever reason, are pleasing to the children.
Yeah, and so what we found was across a large group of children, for the most part, most of the behaviors were maintained by automatic reinforcement. However, some weren't. And the important take-home point to this study is, yes, it kind of confirmed what we already thought, but you can't just jump to that conclusion. You need to at least do some kind of brief functional assessment to make sure. Because if you believe that it's maintained by automatic reinforcement, but it isn't, let's say the child's actually doing it to get a rise out of you, to get attention, then what you do in response to the behavior could actually make the behavior worse. So if the child's doing it because it produces its own reinforcement, it's automatically reinforced, a common intervention for that is to prompt the child to stop doing it. It's called response blocking or response interruption. It simply means you interrupt them from doing it and direct the child to do something else instead.
A replacement behavior.
Yeah, some kind of replacement behavior. And so if you do that as a consequence for the behavior, but the child's actually doing it to get a rise out of you, then you're giving him exactly what he wants, because what he's trying to do is get you to have a reaction. Right. So you need to know what the source of motivation is for the behavior to begin with.
Okay, I tend to think of when things are automatically reinforcing as being the toughest area.
Me too, absolutely.
So, okay, I'm glad to know that I'm not in left field by myself. Okay, because when it's, my favorite thing is when it's attention. I feel like that's the easiest thing to fix in the world.
All you have to do is ignore it.
Well, you ignore that, but give attention to other things and give attention more often, and it takes care of it.
That's right.
But, you know, escape a little bit harder because there's more steps to it.
Follow through,
and you got to make whatever they're trying to escape from not as aversive. You know, there's more steps you got to follow up on. Yeah, it's a little bit harder for me. Access to something, easier for me to do, but when it's automatically reinforcing,
it's very hard because you're not in control of the reinforcer, so you can't withhold the reinforcer.
And so much you don't even know what about it is reinforcing in which way. You know that it's somehow pleasing to them, but how to get them to stop. But you guys are infinitely better at that?
Well, we hope so, or we try to do a good job, but frankly, it's hard. It is probably the single hardest part of ABA treatment for autism is getting long-standing overall reductions in stereotypy. And frankly, even at a top-quality ABA program, it can take a long time. I mean, if you target just one particular behavior and you really intensively treat that in, like is usually done in research studies, you can get a reduction in that behavior. But to get overall reductions in stereotypy can be very challenging because really what you need to do is establish lots of other alternative behaviors. So if, let's say, if you have escape-maintained problem behavior, you can teach the child to ask for a break. And if they can't speak vocally, you can teach sign language, break, you know. And that, a child can learn that, you know, in a day. And you, as long as you reinforce it consistently, that's it. You've got your replacement behavior. But for stereotypy, it's different because think about all the different leisure skills you and I have. Think about all the different leisure skills a typically developing child has. So what you really need to do is build up that whole repertoire of things to do in your downtime, essentially. And so that can take months or sometimes even years.
Wow. Well, and there's a whole other element to stereotypy that I'd love to get your opinion on, because sometimes for parents, we're the most, even though it's the thing we want you to work on, and we say it's driving me crazy, it's driving me batty, we're the most resistant to some of it because we go, really, they can't just do that? It makes them feel better. You know, and there are some behaviors that we kind of go, really, do we have to, you know? And so I know for myself that there are some things I personally was resistant to and saying, okay, and it's a big discussion amongst parents about what do you need to target and what don't you need to target. For our family, we decided that if the stereotypy was stereotypy, if it was things that were going to stop him from being able to do things, we wanted to target that.
That's right.
But for instance, my child loves to hum. He's creating the soundtrack to his own life, always. Very interested in music, and I didn't want to totally squelch that, but we set about saying, here are the circumstances in which you can hum, here are the circumstances in which you can't. I think sometimes that's made it harder because he has to draw the line for himself now at some point.
It's not as black and white as just quit the behavior completely.
But we didn't want to stop it completely, so we had to work on the social rules around that, and we have to remind him and prompt him and say, you know, at first it was, you can't hum here, and now it's, you're humming, is this an appropriate place to hum? And he has to answer, and usually he doesn't, he just, oops, sorry. You know, but it's hard sometimes. There's an emotional element to it.
Yeah, definitely. And I think that you're definitely taking the right approach. I mean, you know, some really sort of hardcore, old school ABA or behavior modification types are kind of thinking, oh no, just get rid of it, it's inappropriate, make it go away. It's not, that's not really how ABA is anymore, and frankly hasn't been for quite some time. I mean, if you look at any of the major ABA textbooks and they talk about how to select behaviors for reduction and how to select behaviors for increase, and it's not arbitrary. You don't get to just pick anything you want to make it go away or make it increase. You need to go through that exact process that you're just describing, which is how does it affect the person's life? What opportunities does it open up or decrease if this behavior is present or absent, you know? So yeah, humming every now and then is not a big deal. Whistling every now and then is not a big deal. You know, some families will allow their child to have some stereotypy time in the bathroom. You know, sure, you want to go in the bathroom and hand flap, more power to you. Who cares, you know? Just don't do that in the middle of class when your teacher's trying to teach, you know? And so that, you know, you and I have that. We all have that. We have to learn rules about what's appropriate and when. And so that's a much more sophisticated way of approaching the problem of stereotypy. You really, it's not about just crushing the behavior anymore. It's about making it so the behavior doesn't interfere with the person's ability to get the most out of their life. That's what really matters.